Dr Manasa. I've done my MBBS from Usmania Medical College and pediatrics from Nilofer Hospital from Usmania again. And yeah, by profession I'm a doctor, but by passion I'm an art of living teacher. I teach yoga, meditation, breathwork, Sudarshan Kriya, and how to manage stress and everything.
నా పేరు డాక్టర్ సాయి కృష్ణ, నేను ఆయుర్వేద డాక్టర్ని. సో నా స్పెషలైజేషన్ నాడీ పరీక్ష. సో ఐఎమ్ ఆల్సో అపార్ట్ ఫ్రమ్ మై ప్రొఫెషన్ ఐ టీచ్ యోగా, మెడిటేషన్ అండ్ ప్రాణాయామ.
Got conceived initially నేను వేరే దగ్గర చూయించుకుంటూ ఉన్నాను. So I was okay with that. I was having my consultations there. But always when I saw the birds outside, and when as a doctor, when I've seen birds in our hospital as well, they all seemed with lot of interventions, many of them being very unnecessary. Lot of syntocin, unnecessary episiotomies and unnecessary epidurals. Not only this, the multiple interventions which are usually not necessary. I, being a person who believes in holistic care, I always crave for a birth which has as minimal interventions as possible, and which is very natural and which helps me be myself. And in this search, my sister came to know about Sanctum, and then she introduced me to the Sanctum's Instagram page. And then we booked an appointment with Sanctum. We got an appointment a month later. And then afterwards, when the first time when we went to Sanctum, అక్కడ కూర్చున్నప్పుడు there will be waiting for sure. During the waiting period, I didn't feel like I was waiting. I felt at ease immediately. ఒక కంఫర్ట్ అనమాట. అంటే మనకి బాగా తెలిసిన వాళ్ళ ఇంటికి వెళ్తే ఎలా ఉంటుంది, మన ఇంట్లో మనం ఉంటే ఎలా ఉంటుంది, అలా ఒక ఇమ్మీడియట్గా నేను ఒక కంఫర్టబుల్గా ఉన్నట్టుగా అనిపించింది. దట్ సెకండ్ విత్ ఇన్ మై సెల్ఫ్ ఐ మేడ్ ష్యూర్ దట్ no, this is the place I'm going to birth. I decided for myself. I didn't tell it out loud, but that moment something from within me told me this is it, this is the place. My intuition, my instinct probably told me that. So it also felt like, it's not like a hospital, it felt like a Lepakshi museum or something like that. Beautiful, calm, serene. When we went for the appointment, we had a very small consultation. For the first consultation, there was a labor going on, so ma'am couldn't give much time. She spoke to us for 10 minutes, but within that 10 minutes, I found that comfort of a mother with Vijaya ma'am. Something attracted me towards her, that there is some genuinity within her, there is a love, and I also found that she has a lot of knowledge. Then I understood, okay, this should be the center I should be delivering. But he was still a little skeptical. Then ma'am told, we'll call back again, we'll connect again. I have a labor to attend immediately, and she went for the labor. And then again, even though we're trying to connect with ma'am again and again, ma'am, immediately after we came home, ma'am gave us a voice message that sorry that I couldn't, catch up today. I couldn't give much time, but we'll catch up later. That little small voice message, it meant a lot to me. Even anta busy ga unna, she took out time to just give that voice message. That again gave me a positive green signal that no, this is the place probably. The first consultation, Vijaya ma'am asked me one question. She told me, what are your expectations about this delivery? How do you want your labor to go on? 4 months previous to the conception, I had an abortion of 8 weeks. I was having my final year examinations of PG during that time, and I suddenly came to know I was pregnant. Probably because of the stress or what, I don't know. I had a spontaneous abortion, and that was so painful, very painful. My husband was with me for sure, but it was so traumatic for my husband that after the abortion he told me, is it okay if we never plan for kids? It left a deep imprint within him that no, if this is what is going to take us to have a baby, I don't want you to go through all of that. That's what he told. Then later, God's will, nature's will, I got pregnant again. Then I told to ma'am, I don't want this labor to be very traumatic for me and my husband. I definitely want another baby also for me. So if I have to go for another baby, I have to look forward to it. So if this labor goes very beautifully and happily, I would definitely want to look forward for another delivery. And when I look back during my second pregnancy, I should feel proud about myself. That is what I told to ma'am. She just smiled and she said, when I was going out of the room, she said, you will have a beautiful delivery. There is no care provider out there who will ask you, what are your expectations about the labor? How you want it to be? before the Lamaze class, I thought, see, we both are doctors. We know more or less about labor. We know. Why should we pay so much money and go for a class just to know the information about how labor goes? I myself have attended hundreds of labors. I have seen labors. Being pediatrician, I go to the labor calls. I know how things happen. Why should I ever, go to a class, spend money, and then again know about everything? And this was one part of it, and the other part was like I was really busy in that time also. I was working in Nilofer Hospital. I was having back-to-back night duties and everything. These classes were there on Saturday mornings. So I was like, I can't take my time out and again go for, attend the classes also. It will be difficult. Then one fine day, I got a call from Vijaya ma'am. She said, no, Manasa, you are going to attend this Lamaze. Only if you attend the Lamaze, I am going to do your birth. Otherwise, I am not going to do. See, you want to birth at Sanctum, you don't want to birth at Sanctum, doesn't matter for me. It's okay, but I want you to attend the Lamaze classes for sure. This is not just about labor, it's much more deep. It has a lot of other knowledge as well. It's an experience which I can't say in words. You have to attend it for sure. That word from her, it felt, no ma'am, I really want to attend, I am going to attend, but the timings are a little like this. Ma'am told, okay, we'll see about the timings, I'll talk if she can shift the timings or something, but you are going to attend Manasa. She told that and she kept the phone. Then I called him and told, no, we are attending the Lamaze, we'll see, we'll just pull out time and we'll try to attend. The first Lamaze class happened, it was true magic, I should say. అది ఎంత బాగా డిజైన్ చేశారంటే ప్రోగ్రామ్ the first class there was one activity, they gave us an activity. I have to do some posture and he has to support me and how I communicate with him, and it's just an activity like they're just observing us how we are going about it. After the activity I really understood when we are in that particular posture how I am communicating with him, even with the eyes, with the facial expressions, with the body language. And they told us this is what happens in labor also. You have to communicate sometimes, you just have to understand sometimes, be there sometimes. I just loved how practically they made us understand with a small activity, right? And the first class, when they told about the natural birthing practices, it blew my mind. The first thing that they told was, never ever birth in a lithotomy position, right? And me being a doctor, I never knew this. My whole practice, like our whole outside practice, 99 out of 100 births happen in lithotomy position. In our government hospitals, in our outside hospitals, or my friends who ever have birth, whenever I talk to them, they told me they have done it in a lithotomy position. It has multiple disadvantages, right? The position is not correct. With that position, the baby is not towards the gravity, it's against the gravity. And then there are a lot of blood pressure changes that are happening. It's not very easy for the body to deliver in that position. Multiple side effects are there, not only for the baby, not only for the mother, but for the baby. Lithotomy position will lead to other side effects as well, leading to multiple interventions as well. I was just blown away with this. Then I thought, oh my God, there is so much I don't know. There is so much that the medical textbook don't say. There is lots of knowledge out there, and then we got excited. The other friends of mine who were pregnant, I was talking to them, they were like, we are opting for an epidural, we are opting for this and that. And I was like, why not epidural? What is the science behind it? And when I came to know about it in Lamaze, that it interrupts the natural hormone system that happens in the natural delivery, and we have multiple options to cope with the labor pains other than just epidural. When I came to know about it, I decided in my mind that no, I will never take an epidural. I have to go naturally, and I want to experience that and feel that within me. The labor pain should be felt within me, and I should see how it goes.
Those Lamaze classes really helped me to come out of our comfort zone and to think beyond what we know in our limited knowledge. Actually, ఆ లమాజ్లో ఉన్నప్పుడు మాకు ఇంకా బాగా క్లారిటీ వచ్చింది. లైక్ ఇట్స్ నాట్ ఓన్లీ అండ్ ఫిజికల్ థింగ్ వేర్ ఓన్లీ డాక్టర్ ఈజ్ a person who is going to handle it. But it's definitely the person who is the mother who is going to handle it more than a doctor. Doctor is and careprovider will be there to guide us to flow through that event without much fear from inside, and with some confidence, with some preparedness, that which is actually lacking in current nowadays in all other hospitals nowadays. అది మాకు చాలా హెల్ప్ అయింది. The process of that Lamaze classes మాకు చాలా డైనమిక్స్ ఆఫ్ ద డెలివరీ ఒకటి బాగా హెల్ప్ అయింది. అంటే ఇట్స్ నాట్ ఓన్లీ అ వన్ డే ఈవెంట్, ఇట్స్ అన్ 9 monthsలో అవుతున్నదంతా కూడా ఇట్స్ ఎ ప్రిపరేషన్ ఫర్ దట్ వన్ డే. బేబీ గ్రోత్ అవడమే కాదు, మదర్లో ఏం చేంజెస్ వస్తున్నాయి, దాన్ని ఎలా అండర్స్టాండ్ చేసుకోవచ్చు, మూడ్ స్వింగ్స్ అవన్నీ కంపల్సరీ వస్తాయి, అవి అట్లాంటివన్నీ ఎట్లా హ్యాండిల్ చేయొచ్చు. అండ్ డే టు డే దాని ప్రిపరేషన్ మోడ్లో ఎలాంటివి లైఫ్ స్టైల్ చేంజెస్, ఒకటి యోగా అండ్ అలాగే చిన్న చిన్న ఎక్సర్సైజెస్ అవి ఎలా గెట్టింగ్ డౌన్ అండ్ అలాగే పడుకోవడం లేవడం ఇలాంటి వాటిలో అన్నింటిలో కూడా దెర్ ఈస్ సమ్ వాల్యూ యాడింగ్ టిప్స్ ఇన్ ద లమాస్ దట్ వాజ్ రియల్లీ హెల్ప్ఫుల్ ఫర్ అస్. అండ్ వెన్ దట్ టైమ్ ఈజ్ నియరింగ్ అప్పుడు ఇంకేమేం చేయొచ్చు, లైక్ విత్ యాజ్ ఏ పార్ట్నర్ మదర్ ఇంకేమేమి ఎక్సర్సైజెస్ చేయొచ్చు, క్వాలిటీ టైం ఎలా స్పెండ్ చేస్తే అది బేబీకి ఇంపాక్ట్ అవుతుంది. దీస్ ఆర్ ఆల్ వెరీ వెరీ నైస్ పాయింట్స్. మనం ఎప్పుడు మాట్లాడుకుంటూ ఉండేవాళ్ళం. దే యూస్ టు గివ్ సమ్ హోంవర్క్స్, బట్ వాటితో పాటు కూడా వీ యూస్ టు డిస్కస్ మోర్ అబౌట్ ద కంటెంట్ ఆఫ్ ద లమాస్. అది మాకు చాలా హెల్ప్ అయింది. అంటే ఇప్పుడు ఈ ఫేజ్కి వచ్చిన తర్వాత మనం టెన్షన్ పడక్కర్లేదన్నమాట. ఈ ఫేజ్ వచ్చినప్పుడు మనం ఇంకా వెయిట్ చేయడానికి చేతిలో టైం ఉంటుందన్నమాట. సో ఇట్లా మేము ప్రతిదానికి ప్రిపేర్ అవ్వడానికి లమాస్ చాలా హెల్ప్ అయింది మాకు.
We both being very busy, we never got time to actually sit and talk about labor before coming to Sanctum. But because of Lamaze, they'll give us homework and they'll give us some handouts to talk about. We'll make sure we'll sit down and we'll read all of that. Not just labor and Lamaze, it helped us understand each other and communicate with each other and everything. This was an excuse when I could tell about my unknown fears to him. There was one question in the Lamaze which told, how do you want you to be treated by your partner during the labor? I wrote in that, I want to be hugged by him frequently. I want him to crack some jokes and make me laugh and feel happy and all of that. I told some other things also which I want for my partner, which I wouldn't have actually gone to him and said, I want this during labor and all that. Because of the Lamaze and everything, I could communicate to him, and he actually made sure he did all of that during the labor. He is not so expressive person, but he kept on expressing everything and encouraging me. That also helped. Yeah, I would say Lamaze is a magic for us. It helped us bond very well, and it's one of the bigger pillar stone which helped us go through the labor really well. Whenever I asked all my friends, they all wanted epidural. Obviously, it's common to have epidural during labor. All are doctors. My friends, 4 to 5 people are pregnant at the same time. Everyone planned the delivery with an epidural. I asked them why. They said, who will bear the labor pains? It's very impossible. And if you don't take the epidural, you don't get the energy to push. That is what they said. But when we attend the Lamaze classes, we know why epidural is not needed at all and why epidural is harmful also, right? Here I want to say, even though we are doctors, we don't know much. We should be open to know lot of other things also. We know only a drop in the ocean. Labor and birthing is an ocean of knowledge. And seeking midwifery help and coming to Lamaze classes will help a lot. Even though you are pregnant, you are not pregnant, you are delivering a baby, you are not delivering a baby, I would say every doctor should attend a Lamaze class to know the knowledge about birthing, to know why an intervention is actually needed and why it shouldn't be done on a routine purpose. In 199 women will be getting a Syntocin drip to deliver the babies outside. Why Syntocin is not needed? In this, doing all of this, you are rushing the delivery and baby will take its own time to come out. When the baby takes its own time to come out, it will be a happy baby because she has come on her own pace. When you have pushed it and you have rushed it and you have given the whip and come out, it will come out, but it will have a trauma. And when the baby has a trauma, it will have a colic. It will have a restless, sleepless nights. Baby will be crying again and again. You will be losing the time. I see it clearly that when it is a natural delivery, lesser interventions, and happy mother, happy delivery, no much trauma, safe place, safe care provider, no much interventions, the baby coming out on its own pace, baby will be very happy, baby will do really well, that you will get a lot of time to do whatever you want to later on. Otherwise, most of your postpartum will be involved in struggling with yourself and struggling with the baby. I would say it's easier to do the labor without interventions than doing the intervention and then suffering later on. Yes, even though I am a yoga, we both are into yoga since many years and all that. I was not very regular about yoga. My sister is a prenatal yoga teacher. She used to take online Zoom classes for me once or twice in a week. But I was not very regular because I was very busy in my hospital. And then after the, probably the third consultation with Vijaya ma'am, she told me, are you doing yoga? I was like, ma'am, probably once or twice a week. She asked me, how much time are you walking and all that. Then I told her, not very regular, ma'am. She took 20 minutes time to explain me why yoga is important, why walking is important. Even though you are a yoga teacher, you need some external force also telling you why it is important for you again. You take it for granted sometimes, right? After that one consultation with Vijaya ma'am, I guess I was like, for sure I did everyday yoga after that consultation. I took out time. We used to do yoga every day. Sometimes he used to come and help me through the postures. I used to do squatting holding him. And then every day we made sure we both walked together. So we both held our hands, walked together in the nature, looking at the nature, and enjoying the nature and also talking about labor. It also helped us bond well as well. Yeah, so that really helped me. After 36 weeks or something, I could realize that it's not just the physical capacities that you get with yoga, it also the mental endurance that increases. It helps you become so comfortable even in the most adverse situations. That mental capacity is what you get with yoga and walking. And definitely I should say, even though I have been into the practice, Sanctum and Vijaya ma'am have been there to make sure that I actually did all of that. On one particular, antenatal visit, it was a routine antenatal visit, 36th week. 36th week, we usually have to go for a consultation, and we went to Vijaya ma'am. She asked me to sleep down. Come on, I'll check you once, Manasa. She put the Doppler. She was like, oh my God, the heart rate is just 80. Immediately she made a call. The gynecologist has come. I was shifted to one room. I was put on CTG, the contraction tracing graph. Ma'am told, I feel that the heart rates are dropping down, but the fetal movements are really good. The CTG was showing the 130, 120 heart rate. In the last 2 to 3 minutes before it was going to stop, it dipped back to 70 to 80. It was there like that for 2 to 3 minutes. And then again it picked up. Then ma'am came again, and then she saw with the Doppler and she saw the CTG. CTG was showing 140, but when ma'am kept the Doppler, it was showing again 80. And then ma'am took us to the ultrasound, and then the gynecologist did the ultrasound. So even during the ultrasound, when the gynecologist was doing it, the kicks were very hard. So there is a Vijaya Diagnostics just downstairs, so we went there for an ultrasound scan again. And then there the ma'am was doing the ultrasound, and in the half an hour period, the heart rate dropped to 80 or 70 thrice. It was significant drop. It was there for quite some period. It was not just like once in a while just coming and going or something. It was significantly, it was dropping for quite some time. Ma'am told, we may have to go for elective cesarean section. Dropping to 80 significantly for this many times is not normal for sure. Baby might be experiencing something which we don't know. We may have to go for elective section, or we'll see how it has to go. Then ma'am told, this is a grey area for us also. By then I had complete trust in my care provider, and one way why we both were also calm was we knew that we were in safe hands. Ma'am told, we'll take a fetal cardiologist opinion. So she rang up to Dr Nageshwarao sir. He's a most senior cardiologist, pediatric cardiologist in the city. He said he'll give the appointment in 2 days.
Here what gave us a little bit strength add on is, Vijaya ma'am used to say a quotation always, that a baby doesn't go suddenly into an emergency condition. A baby always gives preliminary time to work, because 140 is the natural birth heart rate for the babies. If it is coming to 70 and 80, no one will wait. Immediately they will rush to the surgery.
Yeah.
They were not into that panic mode. Either Vijaya ma'am or us, we are not in that very panic mode. We are working on some area, and there is no restlessness in us. There is no, of course, there is concern of the health. That should be definitely will be there, but we are not very lost in our confidence and all. As per Vijaya ma'am's advice, we went for the second opinion with the leading practitioners.
Yeah. After 2 days, we went to the cardiologist, sir. I was walking inside the 2D echo room. He told, oh, you are the one which Vijaya ma'am told. Why don't you go for a section? So
at this point, really what went in our mind is, it's okay, we had Lamaze and we also had a very good journey. We are into that and very receptive mode and in deep acceptance, whatever it might be. If it is very much required, we'll go through it, but we are ready for whatever the decision the experts are giving.
We were not panicking. That was very astonishing about ourselves also, that we were receptive towards it. Whatever is good is going to happen for sure, but we definitely wanted to go for a normal delivery if it's possible. He did a 2D echo and he told the baby is having a fetal ectopic beat. The baby's heart, there is normally a hole between the two atria, which is normally present in every baby, which gets closed after the birth of the baby, right? So there is a flap closing it and it's little very thin, and the flap is moving here and there. The interatrial septum is very thin in our baby, and the flap is moving very fast here and there. Because it's moving here and there, it is producing some ectopic beats. So because of that, the heart rate is coming down once in a while to 80 per minute. Then he checked everything and he told, so the baby has no consequences because of this. The baby is feeling completely well. If at all there was a consequence, the baby would have been little swollen up, or there will be some pressure changes. The pressures look completely normal. The baby looks completely normal. You can wait till 38 weeks, and once the 38 weeks is done, you can go for an elective section or induction. This is what sir told. And then he told, see, it is not having any effect right now, but if it is very frequent, the ectopic beats are very frequent, then there may be consequences in the baby. Then he asked us, you have to come back every 3 days. At that time he told, come back on the alternate day and we'll check it again and then let you know how it is. Again we went back on the alternate day. That day the fetal heart rate was quite normal. Only once it dropped.
1 week of regular checkup, I asked the doctor, doctor, you are suggesting for an elective delivery. I have one question. If we wait beyond 38 weeks, what can be the course of development or any consequences or any adverse effects will it happen? He said that no, nothing will happen. But you have to keep on checking whether it is going right or wrong.
Then Vijaya ma'am had a call with Nageshwar Rao sir, whether we can deliver her in this model of care. I told you can deliver, not a problem, the baby might not have any consequences. So immediately Vijaya ma'am had a call with me and told, so this is what Nageshwar Rao sir told me, what are your fears? What is your take about it? I then spoke again to Nageshwar Rao sir and asked, sir, will this baby need an NICU support? He told, not really. If everything goes this way, how it is going right now, the baby might not need any NICU support. With one word of that and one word with Vijaya ma'am, again I came back to my thing that no, I will again deliver at Sanctum.
We went 39th week also for the final one more talk with Nageshwar sir. He said that, okay, this is now good. The septum between the two chambers of the heart, it's slowly better now, and you can wait, definitely no problem. And after 2 days, as a regular visit, when we went and asked him, it's not a problem. You can go as per your wish.
So we came back to Sanctum. We both sat with Vijaya ma'am, and when we were having all this conversation, she told me, it's okay, Manasa. Let's not do too many scans also now. I don't want to scare you. There's too much that has happened till now. I want you to relax right now. That was another, daring step of Vijaya ma'am, I can say. Even though we are under her care, anyone would always want too much monitoring if something is going bad. But she has that skill in her, she has that confidence in her that she doesn't even want to panic the patient too much also, and also be careful at the same time, but doing only minimal that is necessary. That is a wonderful thing about Sanctum, that anywhere you are, I being a doctor, we always tell the worst only to the patients, and we want to be extra careful always, because anything may go wrong, it should be on her. But she took the risk, and she made sure that I am comfortable at the cost of not doing too many scans also. That I think no gynecologist or no other person anywhere in the world would never say that. She said that to me and she was so confident, and she told, I feel everything is fine, Manasa. And she told, what is your intuition saying? This is the question she put me. She told me, ma'am, I feel I'll have a normal delivery. I feel it will be a beautiful delivery. We both have that intuition. She said that, she told, I really wish that intuition comes true. Where do you find someone who will ask you what is your inner voice telling you, right? She gave that importance to my inner voice, and she knows that a mother's inner voice is always true. Because a mother will get a hint when it's something is going wrong. How many will do that? I would really appreciate ma'am for doing that. హార్ట్ బీట్స్ అటు ఇటు అవుతూ ఉన్నప్పుడు దెన్ విజయ మ్యామ్ ఆస్క్డ్ us to get a consultation from Kameshwari ma'am, the senior gynecologist. She saw the whole report. She asked us, what do you understand from this? We explained the whole thing. Why are they so calm, Vijaya? Like, we know the heart rate of the baby is here and there. We know that something is happening, but we both are sure baby will be completely fine, and we both are sure that it will be a normal delivery. I was like, how are you both so sure? How are you so calm? There's so much happening. We are worried so much about this. How is it happening? Vijaya ma'am told, they are like that.